Traumatic brain injury, it's a major cause of death and disability in the United States. And according to the Centers for Disease Control and Prevention, 30%, that is a big percentage of all injuries are death. So doctors, let's talk about that. When we hear the term traumatic brain injury, is that the same thing as a concussion?
Well, often the terms are used interchangeably. So concussion is considered a mild traumatic brain injury.
And is it more prevalent in teens and kids, or is this something that affects all ages?
It affects all ages. Kids or teens seem to be more susceptible to brain injury, maybe because their brains aren't as well developed.
So is that something you see? Is it just brain development, or is it, I don't know, more sensitivity to that?
Oh, they're more sensitive. They have less cognitive reserve, so their brains don't really have the capacity to suffer concussion as well or recover as well as adults would.
And let's actually go and see what is a concussion and the importance of that recovery. And we have a short clip here from the CDC that's going to explain that to us a little bit more. Let's take a look.
Concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
Talk to me about what this video means, and again, this concussion. Is it something that affects a child more because it's still developing, like you said?
Well, clearly it affects a child more. We realize that. The reason for the concussion, like you saw in the cartoon, is because the skull is a rigid, fixed structure, but the brain can still slosh about inside the skull, thereby causing all the events that occur in brain dysfunction. So concussion is a traumatic disturbance of brain function because of the movement and injury to the brain structures.
What injuries? Let's talk about that. I think that's important to know. What injuries cause concussions? We talked about motor vehicles, maybe some falls. Elaborate on that a bit.
Well, I see all comers, certainly recreational activities, football, lacrosse, activities like that. In the workplace, we see a lot of falls, things falling on people's heads, motor vehicle accidents, falls. Certainly we see at the hospital, people fall and will have a concussion. So I see it in many different realms of society.
We actually have a 3D model of what's happening during the brain during a high-velocity collision. And Dr. Herskowitz, will you tell us a little bit of what we're looking at? Because we're seeing this video, but we need your expertise on this.
Okay.
So what are the three casings for the brain that we're seeing right now?
Okay, so the covering, you can see the brain, and the covering of the brain is called the meninges, and it's made up of three different layers: the pia, the arachnoid, and the dura, and those are these three layers. And there's also some spinal fluid called cerebral spinal fluid, which bathes the brain. The brain sort of rests in this fluid, and that acts as a protective mechanism for the brain. However, in movements like this, such as a whiplash, the skull doesn't move, but the brain will slosh inside the skull and thereby cause the injuries we see in the brain.
So I'm seeing, like you just said, the brain is bouncing around, but everything that you have explained, that is sort of supposed to protect the brain, correct? That's a structure.
That's correct. That does protect the brain, but not in these high velocity injuries, in these whiplash, forward and backward of the head. The brain still sloshes inside the skull and can cause injury.
And what kind of damage are we seeing when with these type of injuries happen, like a whiplash with the brain?
Well, you can see there's things you can and you can't see. So the cascade of events that occur in concussion, you can not see, and those are the neurons that are affected. That's a microscopic level. What you can see sometimes is the areas that are most vulnerable to injury are the frontal aspect and the temporal aspect. So when the brain moves inside the skull, you can actually damage the brain against the skull, and that's called a coup contra coup injury. And you can see hematomas and contusions actually in the brain from these types of injuries.
That is absolutely interesting, Doc. What are some of the risks of a concussion? And we actually are going to come back and have a graph that's going to show us some of those symptoms. And we want to talk about some of the warning signs. And we're happy you're here to help us with these symptoms, because they're divided into four. We have thinking and remembering, we have physical, we have the emotional, mood, and sleep. And they can be, they're severe. I mean, everything from blacking out to nervousness or anxiety. So talk to us about these symptoms.
Well, these symptoms are very common. Thinking, remembering, people often will feel different. They will feel foggy. They will feel like their just brain is not working. They'll feel like themselves. Physically, we see a lot of headaches and dizziness, nausea, photosensitivity. Those are all very real symptoms that are very common. Their mood will often change. They may become depressed, irritable, anxious. They may cry, they may laugh, they're nervous. It's just, it's a big emotional issue. And sleep as well. They don't sleep as well. They get fragmented sleep, they have trouble falling asleep and staying asleep. So these are all the symptoms that we see on a daily basis in patients with concussions.
Is it safe to say that these symptoms don't just happen overnight? Some of the symptoms described here in that graph are something that it can be prolonged, correct?
Oh, correct. I mean, they initially will start out right away, immediately after the concussion. Generally, the symptoms last about 7 to 10 days, and they will resolve in about 80 to 90% of people. But there's the small percentage of 10 to 20% that will have prolonged symptoms. And we will talk about post-concussion syndrome, but the symptoms can last months or sometimes even longer.
What are some of those symptoms that you say can happen right away, that you notice?
Right. The ones we discussed, headache, dizziness, nausea, blurred vision, light sensitivity, emotional lability. Those are the things that are pretty common.
You often hear people when they have had a concussion or they fall, they say, I'm forgetting, I'm blacking out. I mean, how serious is a symptom like that when it comes to concussion?
Well, amnesia occurs in about a quarter of concussions. And there's different types of amnesia. And there's retrograde, where people will forget what happened right before the incident. And then anterograde amnesia, where they will actually be unable to form new memories. And so amnesia, we used to think that may have been a predictor of prolonged recovery, of worse outcome. It's not quite clear, but certainly it does happen.
And how long could that last?
Generally, it lasts probably as long as the concussion symptoms will last. The retrograde, you may never get back right before the concussion.
So you can actually not remember things that happened in the past and never recover that memory.
Right. Generally, that's the immediate, immediately prior to the impact.
Okay.
It's not, kind of remote memory. That's usually that persists.
Wow. Okay, so a headache. Sometimes we get a headache, but that can also mean a mild concussion. Is this true, or
right,
like recurring headaches?
Well, with headaches, you need to have, or with concussions, you need to have a history of a head injury. So I see headaches in my practice all the time, but without the historical aspect of a head injury or concussion or blow to the head, then concussion is not considered as the etiology of a headache.
So what is the prevalence of concussions? And is it more dominant in women? Is it more dominant in men?
Well, the numbers vary, but it's about 2 to 4 million concussions per year in the United States. So it's a societal problem. Women tend to have more concussions than men do. If you look at similarities in sports, basketball and soccer, comparing men and women appear to have more concussions than men do.
Why is that?
Well, one reason is perhaps the neck muscles aren't as strong to really prevent the rotational force of the head. There may be other factors we don't really know.
I think the most important thing to note here is how soon do you need to get treatment if you feel? Right.
Well, absolutely, right away. It's imperative because, number one, you don't want to go back into a game with symptoms of a concussion because of risks, I'm assuming that we'll talk about, but you also, it can affect your recovery. So if you have symptoms of a concussion, and that comes with educating the participants and educating everyone involved in sports, if you have symptoms, you need to report that to the physician immediately.